Hello everyone. I'm making this video to discuss a medication known as Metoprolol, which is the generic name, and the trade name is Lopressor. I'm going to present this medication as the treatment for high blood pressure. I'm going to start by introducing the topics that I'm discussing today, which is the overview of the prescription Metoprolol. The uses include the lowering of blood pressure and heart rate. It can also treat high blood pressure. It can prevent chest pain or further damage after a heart attack. It can also reduce the risk of death from an acute heart attack. It is also used to treat heart failure and to manage heart rhythm disorders. It is a generic drug which is an exact copy of the active drug in a brand name medication. The generic is considered to be as safe and effective as the original drug. Secondly, how does Metoprolol work to treat hypertension? That is, how does it work in our body to treat high blood pressure? It works by lowering blood pressure and heart rate. It makes it easier for the heart to pump blood to the rest of the body. Again, what does Metoprolol do in our body? Metoprolol, also known as Lopressor, works by blocking the effects of epinephrine on beta 1 receptor within the heart tissue. It causes this heart to pump more slowly and with less force. This is less work for the heart. And that is why this medication belongs to the class known as the beta blocker. It improves blood flow and circulation by relaxing the blood vessels that carries our blood, and this makes our heart rate to become slower as well. The fourth part of this is to talk about the side effects. Metoprolol can cause side effects that are expected. These expected side effects are not alarming at all, but they need to be known. Uh, we have the more common ones and we have the less common side effects. And at the same time, we have the rare side effects. Let's go with the more common side effects. This includes blood vision, chest pain or discomfort, dizziness, lightheadedness, sweating, and unusual tiredness or weakness. That is the more common side effects of Metoprolol. How about the less common side effects? Less common ones include bloating or swelling of the face, arms, hands, lower legs, or feet. Um, Chest tightness is also one of it. Coughing as well, and it can even bring what is called decreased urine output. Headache is one of them, and unusual weight loss or weight gain, either or. Um, Some of the rare side effects of this medication that needs medical attention immediately are bluish color of the skin, fingers or toes, chills, clay colored stools, fever, lower back pain or side pain, muscle pain or stiffness, and numbness of the fingers or toes as well. So, these are the side effects. Now, let us talk about the education that patients taking this medication needs to be aware of. First is the mechanism of action, that is, how this medication works in our body. Uh, our patient need to understand that this medication is used to treat high blood pressure and heart conditions as well. Second education is for a patient to know the interaction, that is the drug interactions. These medications or activities that can have adverse effects when we're taking them with this medication. So, some of these drug interactions include some other blood pressure medication might interact with metoprolol, and epinephrine might interact with metoprolol, and most antidepressant medication, that is those medications that are used to treat uh, depression, can also have interaction with metoprolol. Dobutamine and dobutamine can also have interaction with this metoprolol we are talking about. Uh, Common adverse effects, I've mentioned that before, but adverse effect is different from side effects. Side effects are the expected ones. Adverse adverse effects are the unexpected ones that needs medical attention immediately. This includes dizziness while you're taking this medication, uh, unexpected tiredness, and depression. Also, confusion, rash, diarrhea, shortness of breath, hypotension, and any itching that starts after you're taking this medication. These are adverse effects. They are not expected and needs to be taken care of immediately. That is noticed while you're taking this medication. Now, let's talk about the mode of administration, how we take this medication. This medication comes in tablets. It can be taken with water by mouth. Uh, we can take it with meals or immediately after meal. It can be taken. Okay. So the main thing about this is this medication should be taken as prescribed. It should be taken as prescribed. It should not be taken more than prescribed or less than prescribed. Okay. So let's go to the special consideration on children and the elderly. Metoprolol, otherwise known as lopressor, can be taken by children and can be taken by adults. With the children, it has to be with specific considerations for the administration. Monitoring is also included when children are taking this. Pediatric patients require special consideration due to the differences in the physiology of children compared to the physiology of the adults. So those are the special consideration concerning Metoprolol, otherwise known as Lopressor. If you have any questions or concern, you can let me know. Thank you.